You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Rudy Wassenaar. Dr. Wassenaar, welcome to the program.
Thank you, Randy.
Now, you're the guy, right? Rudy is the guy.
I've been told I'm the guy, that's right. Yeah.
So at the local theaters in Canada, you have this ad. Tell me about that.
Well,
people talk about it.
Yeah, all the time. Like I did this treatment for this patient. Her name is Joan. She had failing teeth, and she just hated the whole notion of maybe having to have dentures. She didn't want dentures. She also wanted to have a nice smile. We gave her a brand new set of teeth, supported by dental implants, and what that means is that they stay in, they look good. She was comfortable with it. She could chew what she wanted, and she was really, really happy with it. And she's been on record now saying that I gave her the smile that I promised, and I'm called Rudy is the guy now.
Rudy is the guy.
That's right.
And so that's what they say about you. And you were even, somebody yelled at you from across the street.
Well, that's right. Yeah. That's just. Can I talk about the commercial?
Yeah.
Yeah. We put this commercial together in the and running in the local theater, and it's so popular that I've had people yell at me across the street, saying Rudy is the guy. The manager of the theater has said that sometimes everybody in the audience is chanting it, and when they know the ad is coming up, because Joan is such a genuine person. And she's local.
That's nice.
Everybody knows Joan. Joan knows everybody else. So yeah, it's been quite interesting.
Okay, good. Now at the top of the show, we said nobody should be wearing a loose-fitting denture. So you don't like traditional dentures as far as the way they typically work?
No, let me tell you. Like I graduated from the university in Amsterdam, and back in those days, that was in the late 70s. Where they just came more involved with dental implants, and my university was part of that. And I looked at that and I said, you know what, making dentures the way we always have, always will, it doesn't make any sense. Of course you need to have something that will anchor them in place. And now we fast forward 30, 35 years later, implants are now so predictable. They're so well accepted by so many people that there is no reason why anybody would have dentures that don't stay in comfortably.
Okay, now I know you brought a lot of before and after photos, so we'll show those, as many as we can. We should mention, so here in the U.S., we're taping this here in California, you are board certified by the American Academy of Oral Implantology, which isn't recognized in Canada.
That's
we
correct.
should mention, what we're talking about today, I guess you teach other dentists about dental implants, you lecture on the topic, and I guess you're credentialed. A lot of training for implants.
That's correct.
Is there that much to it?
There's a lot to it.
Okay.
There's a lot to it. Like when I started out with the implants, there was no formal training available. So you would go to some kind of hotel or you go to some kind of seminar, they'll tell you a few things, you take it to the office and try it out. And surprisingly, I got good results in doing that. But the last probably 15, 20 years, I've become a lot more structured and surrounded myself with very qualified people. And eventually, I completed a graduating program, which gave me that kind of recognition. Yeah.
Now, is it true, as we've talked about, that people on the day of the procedure, the final procedure, they could walk in with no teeth and walk out that day with a brand new set of teeth?
Yes.
That don't come out.
Is that right? We can do that. That's correct. Yeah.
And so that's happening all the time?
It's not often enough, but it's happening quite often. Yeah.
Okay. Are there a lot of people in Canada that have like a denture?
You know what? It's unbelievable how many people are missing teeth. Sometimes it's a few, sometimes it's a lot, sometimes it's all of them. And surprisingly, a lot of folks seem to think, well,
like a million people with dentures?
Oh, easy.
Really?
Oh, yeah, easy. Yeah, more than that. Yeah.
Then if dental implants are so good, right, to kind of take those dentures and lock them in, why aren't they all doing it? What's your take?
Oh, I thought about it a lot of times, and I think what it is that denture patients don't see the dentist anymore. They have their dentures, they forgot about their teeth, and they probably didn't like going to the dentist in the first place. So let's face it.
Good
point.
And so they don't know their options. If
they don't know their options. So the reason is that they're afraid of the dentist. And let's look at it. They've had root canals, they've had teeth taken out, they had fillings fall out. And every time they go in, get work done, get frozen up, and pay the bills and so on. So they lost kind of faith, they lost kind of confidence in what dentistry has to offer. So they're out of the loop.
So they lose all their teeth, and the last thing they want to do is see you.
That's right.
Do you hear that still? By the way, no offense, doctor,
All the time.
Really?
All the time.
Like, how do they say it?
All the time. Some people tell me, ladies, sometimes that I'd rather have another baby than go to the dentist. And you know what? That kind of hurts.
Do you have a funny line after all these years of what a comeback line for this when they say I don't like coming to the dentist?
I'm still looking.
Is that right?
I'm still looking. I don't know. Yeah, I'm still looking. Yeah, it's.
How old can you be to do this?
You can be almost any age as long as you're healthy. I've placed implants in patients that were like in their 80s, early 90s even.
Okay.
Yet I've seen people that are in their 50s and they'll say, well, I'm too old to get dental implants done. So it kind of varies, but...
So a 90-year-old, why would a 90-year-old want to do this?
They want to chew. They want
Okay.
to. They want to smile. You know, they want to eat their steak. They want to. They want to. You know, hang out with their grandkids and the teeth not fall out. It's that hard for some folks. You know, they do almost anything to keep that going. Yeah.
Now, isn't it true though that if you've been wearing a denture like 10 or 20 years, you can't do this because you don't have enough bone?
That's not true.
Okay.
We can definitely create a situation where we can restore that, rebuild that, and put implants in and let them function at a much higher level as before.
But is that a common question? Like, do I have enough bone?
We get this all the time.
Oh, really?
We get this all the time. There's this sense out there amongst the public that it's impossible after some time. It's simply not true. We can do all kinds of things still. Yeah.
Okay. Now in Canada, you have denturists.
That's correct.
You
yeah.
said they're part of the team. You look at them as part of the team.
I definitely do, and the reason is that the denturists, they make all the dentures.
Okay.
You know, and they know that when they, particularly lower dentures, but most people have most trouble with, they know that they cannot make a denture that's going to do what it needs to do, and they recognize more than any professional that dental implants are the way to go.
So are the denturists starting to send you patients?
Yeah, they send me patients on a regular basis, and then we look at them, and it's amazing what we can do. You know, we can do all kinds of things for these patients. You know, lock in the teeth to the gums if we need to, or maybe just help keep the denture in place. Whatever the case requires, we can do that. Yeah.
So you say it's life-changing for many of these people.
It is life-changing, you know, and this case here.
Okay.
Well, this guy's name is Vic. He came in and he knew his teeth were failing. So we gave him a full arch of teeth, held in place by some implants.
Okay.
And he basically left the office smiling. He could not believe, you know, looking in the mirror after we were done. And he was still frozen. He was still half sedated, you know, how good it looks. It's so rewarding as a dentist to be able to offer these services to people like him. Look at his face. Look at his smile. Look how happy he looks. You know, he's just ecstatic that his dream kind of came true. He had teeth again, and he didn't have dentures.
So what could he eat? I mean, does he have to be careful what he eats?
The first couple of months, as things heal in place, we tell our patients that they need to be careful, soft diet,
Okay.
you know, not don't go too crazy. You know, it's like when you break a leg, you know, you don't start playing basketball the day your cast comes off. You know, you need to kind of be kind of careful. Same thing with dental implants. The good news is that it gave him self-confidence back. He liked his smile. He could eat what he wanted to. He ended up moving to a new location, got himself a new place to live in, a new neighborhood, and rumor has it he even has a girlfriend again.
So with this guy, I mean, he could eat whatever he wants, like a steak, like a tough steak or pizza or whatever.
This is not the kind of guy that eats stuffed steak. You know, he'll go for the tenderloin.
All right.
Which I recommend in any case. Let me tell you about another case.
All right.
This patient came in and her upper teeth were failing. And she was dreading the fact that she's going to lose those teeth. And she kind of came to me on a recommendation by her husband. Her husband is an electrician. He's retired now. But
Electrician?
Electrician,
Okay.
yeah. And I did some work on him, and then he kind of convinced her to come and see me. And so she came in, and we looked at it, and made her a plan where we would give her new teeth held in place by a number of implants. Now, she was very picky about her appearance, and she had this gap between the two front teeth all of her life.
So when I'm looking at that before, those teeth could not be saved.
So the teeth that she had before, they could not be saved. You know, she had gum disease, and some of them had fallen out already, and she just knew that it was time to do something.
Okay.
But she was very picky about how her teeth looked, although they weren't all that very good shape. So she requested, well, I want them to look as much as possible to my own natural teeth. So my friends don't know that I got new teeth. But you know how it is. Sometimes, you know, people, they go into this kind of dentistry, and then everybody sees they got new teeth because it's so
Yes,
different.
yes.
So in her case, we did exactly what she wanted.
You kept the gap there?
We kept the gap.
Take a look at the after.
Yeah.
Oh, wow.
We got the color right, we got the gums right, we got the smile right, everything worked out beautifully. Well, we did this procedure for her in the office, and at the end of it, we set up the chair and we gave her a mirror to look at the new smile. And though she was still half sedated and a little groggy with the anesthetic, she said, "Oh my God, these teeth are beautiful." And we've been working hard on that case, before and during the actual procedure itself. And for us as a dental team, it's so rewarding to get that response from our patients. Well, there's two types of people, some only care about, well, as long as they can chew, I'll be happy. And then they're surprised.
Like they don't care how it looks.
No, but once we're done and they can chew and they look in the mirror, they're quite happy about how good it looks.
Okay.
And then the reverse is that some people say, well, I don't care about chewing, I just want to look good. So when you make it look good, which we do in any case, they're surprised to hear and find out they can chew well too. So yeah, it's good on both sides.
Dr. Wassenaar, we're going to take a quick break. We come back, more about options for denture wearers. You're watching The Wellness Hour. I'm Randy Alvarez, news that makes you healthier. We'll be right back.
I live in Williams Lake, and why I find it very special, as I was actually raised here, it's just a great country. It has all seasons, people are friendly, and we have a good dentist, and his name is Rudy. When he said he would give me a smile, he did give me a smile of a lifetime, and here it is. A diamond. So he is my dentist. Rudy's the guy.
I came to Dr. Wassenaar here in Williams Lake for implants, just to talk to him about implants and that sort of thing. And that was back in '89. He put in 4 implants in the front. Now this was cutting edge, let me tell you, cutting edge of implants. You can imagine that's what, 22, 23 years ago? Well, I would highly recommend Dr. Wassenaar to my friends, and I have recommended Dr. Wassenaar to a number of friends, not only here in Williams Lake, but the surrounding area. One comes down from Quesnel regularly. He has done a lot of work for her. She's very happy with it. We're absolutely blessed to have someone of that quality and qualifications to be in our community. And it's just a joy to be here. It really is. People think, oh, I have to go to the dentist. But no, not here. You're welcome to come in, and they'll even walk you out if they have to. But they're great. A joy to come.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to Dr. Wassenaar, he says nobody should be wearing a loose-fitting denture. Dr. Wassenaar, welcome back to the program.
Thank you.
Now, we should mention, you're a general dentist in Canada.
Yes, yeah.
Here in the U.S., you are recognized, board-certified American Academy of Oral Implantology. You teach other dentists how to do implants. Does it cost more to go to a guy like you? I mean, you've done over 3,000 of these.
No, it doesn't. And actually, I think in some ways it's less because we've done so many of them. We have a system basically for every conceivable scenario.
Okay.
We do it right the first time.
So you're big on sedation.
Definitely. Sedation is a wonderful thing for a whole bunch of reasons. The patient is kind of disconnected what goes on in their mouth and what's happening around them. For us as a dental team, we can go and do the procedure without worrying too much about how the patient's feeling because we know they're doing okay.
So you do oral sedation?
Yes, we do oral sedation and also in combination with laughing gas. We're finding between the two ways of doing that, most people are kind of drifting in and out of sleep. And what it means is that they have a lot less stress during the whole procedure. They don't even remember they were in the office. They don't even remember what went on while we did all the work for them. And then as their stress level stays down, the anesthetic works better, their vitals stay within healthy range.
So you monitor like their heart rate, their oxygen levels, things like that during the procedure?
Yeah, we monitor all the vital signs, the heart rate, the blood pressure, the rate of breathing, all that's being monitored. And we're just finding that if we sedate our patients, they do a lot better physically than if we don't. Let me show you this next patient.
All right.
This is a gentleman, years and years ago, he was involved with a work accident and had a lot of damage done to his teeth. and it was fixed at the time, but the dentistry 30 years ago, it was failing and it was basically falling apart. This was an interesting patient. Like, he came in with a binder full of documentation. He had seen other dentists and he was given different recommendations to the point that it just confused him. And he came to see me just to make some sense out of all that.
All right.
And so I went through all that, and I had a good discussion with him and asked him a whole bunch of questions. So I figured out what it is he was looking for. And then we went ahead and said, okay, let's just remove those teeth. We can't really fix them anymore. They're too far gone. He said, yeah, I know that. And that's why I'm here. What we can do is we can put some implants in, and then we'll attach a brand new set of teeth to those implants.
Okay.
And can we do that? Yeah, we can do that. Well, how long will it take? One appointment. He said, one appointment. I said, yeah, one appointment. And that's exactly what happened. And if you ask a picture, that's show the viewers, that was taken about 2 days after we did the work for him.
And how long will they last? I mean, the studies, what are they saying?
What we're finding with these types of things, we're looking at a 30-year lifespan.
Okay.
25, 30-year lifespan, which for most people is long enough.
What's the number one thing they're afraid of? Like when they go in on the consult, right? They have really bad teeth.
Yeah.
Or maybe they're currently wearing a loose-fitting denture. Like, what's that discussion like? Like, what are their biggest concerns?
What I found with all patients, it doesn't matter what we're doing for them, they have 3 things on their mind. One is it going to hurt? Second, how much does it cost? Third, how long does it last for?
Okay.
That's all people need to know. That's all they want to know. You know, if you satisfy these concerns for them, usually there's no other concerns.
Okay. You know, we should mention, so I guess even in Canada and here in the US, that how dental implants are normally done is in 2 places. You go to one place that does the surgery, and then another place where they put the teeth on top.
Yeah.
At your center, you do both parts.
That's correct, yeah.
And even the imaging normally is done elsewhere. You have your own imaging center right there.
We do it all. You know,
Okay.
we do the imaging to figure out how we plan the treatment. We prepare for the case. We do the implant placement, and we also make the teeth on them. So it's all done under one roof. I'm in charge of all of it. So in my view, we're getting better results that way. Plus, we could pass some of the savings on to the patient because
Okay.
it's more cost effective doing it this way. Here's another patient. She was told by her grandkids why her teeth look the way they look. Well, they'll use a different term, but in any case, she came in and she asked me, well, what can you do for me?
So she was motivated by what her
that.
grandkids said.
Yeah,
All right.
yeah. She was embarrassed. She was embarrassed by that, you know, and embarrassment in people, for people that have failing teeth, it's a big deal. Now, with her, she thought she was heading for dentures. People looked at it, and she had gum disease, and she had some broken down teeth. But you know, with a bit of work and effort, we were able to save most of those teeth, added some implants, and gave her a beautiful smile.
Nice.
She was very happy. She couldn't wait to show her friends and grandkids, obviously. And yeah, it's been a wonderful case.
And you get a lot of online reviews.
We get a lot
Happy
of
patients.
happy patients. Yeah, I'm proud to say we've got a lot of happy patients out there. And for us as a dental team, it's very rewarding to see all our hard work pay off and have people leave satisfied and happy with what we can do for them.
Okay, we're going to take a quick break. We come back, more about the process, what people could expect on the dental implant process. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
I chose Dr. Wassenaar for my dental treatment as a result of consultation that I had with my dentist. And they pretty much threw me down and made me come up to visit him, and I'm happy I did. The treatment that he did for me to improve my smile was that he placed 4 implants in my lower jaw and made the, you know, and he created what you see now, and I hope it's satisfactory. My wife likes me, and my lifestyle has improved. There's no doubt about it. I feel better about myself. I converse with people with confidence. I can open my mouth and smile at people and give them a genuine grin. and I can eat anything I like. It's great. Not so good for the waistline, but I'm enjoying it so much. Before I had the implant surgery and got my new teeth, I really wasn't eager to smile in case somebody saw my old teeth. You know what I mean? It was a little bit embarrassing, and so I'm really happy with my new look. I'll continue to recommend anyone who's in need of dental service in regard to anything that they require, not just implants, because I know that if I recommend someone to come and see Rudy, that they'll be very happy. And I'm confident that they'll be treated as well as I've been treated. And the worst thing to do is to recommend somebody to a friend and they have a bad experience. I'm not worried about that in the least.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to Dr. Wassenaar, he says nobody should be wearing a loose-fitting denture. Dr. Wassenaar, welcome back to the program.
Thank you.
All right, lots of photos. We've mentioned that you are the guy.
Yeah,
Now, for
I'm the
people
guy.
just tuning in and don't know, that you do this clever ad, and you played in the local theater.
Yes.
And where it says, Rudy is the guy, a patient that was going to get dentures, and you gave him their teeth back, a brand new set of teeth with implants.
Yeah.
So it's really that popular. I mean, people recognize you with that line.
It's absolutely phenomenal. Like she's such a charming person. You know, everybody knows her. She knows everybody else too, and she goes on and on that I promised her a nice set of teeth and beautiful teeth or a nice smile, and that's exactly what she got, and she was just ecstatic. So she does a little testimonial for us, and at the end of it, she says, "Rudy is the guy." And what's happening now is that
It kind of picked up and kind of grew.
it picked up and got a life on its own. And the manager of the theater, he told me that on occasion, the whole audience will chant that. You know, I've been yelled at across the street. You know, people saying, "Rudy is the guy."
Rudy is the
because
guy.
it's a small town, everybody knows me, so that's why.
Okay, good.
That's
good.
quite funny.
Now, let's start off first with options for denture wearers. There's two types of people. I guess there's people with really bad teeth, like bleeding gums, bad breath, loose teeth. They feel like they're going to lose their teeth or they don't know their options. That's one group. And then the other group, and you can't save their teeth. And then the other group are the denture wearers. So what are their options when it comes to dental implants?
So 2 implants just to hold the denture down. Or I can give them some more implants and get more and more stability, and so it stays a bit tighter.
Okay.
And if a person wants the teeth to stay in all the time so they don't come out like natural teeth, that's what everybody really wants. You know,
The
4 or
teeth that
5
don't come
implants.
out.
That's right, teeth that don't come out. That's what everybody wants.
What about the upper? Now, isn't the upper denture fine because of the suction?
The upper denture is much better in that respect compared to a lower denture, but the whole roof of your mouth is covered. You have a lot of taste buds on the roof of your mouth, so you taste your food. You know, you can better sense the texture of your food if it's not covered with something. Another thing is that some people gag a lot. So if the denture is extended into the back of the mouth, you know, then it makes them gag, and that's no way to live either. So on the upper, we can do the same thing. Have teeth supported by implants that do not come out.
Okay, what if you have bad gums? Like somebody watching this and they have really bad teeth. If you have bad gums, can you still do this?
Yes, you can. Yes, we can. We can deal with the gums, you know, we can make them healthy again, and we create a situation where that's manageable. People with bad teeth, they're being judged. If your teeth don't look nice, you know, people kind of think that you're not trustworthy. People might think that you're not very likable. It has an effect on your relationships. Not just me saying that, but there's studies, you know, study after study that says that if you have good-looking, healthy-looking teeth, life is just better.
Okay.
I really believe that.
Now, and we were talking in the green room that, you know, when they're making movies, like in Hollywood, that if you want to make somebody look poor, you give them bad teeth.
You give them bad teeth.
If you want to make somebody look like a villain in a movie, you give them great teeth. Or
you give them bad teeth.
If you want to make them look dumb,
you pull a tooth out.
The front tooth is missing. So it's a big deal.
Yeah, it's a huge deal. Huge deal. And the thing is, what people do when they don't have nice teeth, they don't tend to smile. And if you don't smile, people don't really trust you. They don't treat you the same. People are very judgmental that way. And I got a case here that shows quite clearly
Let's take a look.
how that works. When you look at this person has a life, he has a story to tell, but nobody really will listen to his story looking like that.
Looks like a grumpy guy.
Yeah, look like you don't want to talk to him. Looks like, he wants to be left alone. And yet, he's the most congenial, pleasant person you would ever meet. But nobody would even know that. So
So what, he's hiding his teeth under there? He just doesn't like them?
he doesn't like his teeth, and he was convinced that nothing could be done about it. And,
Except for a denture.
That's for a denture. And he came in and said, "What can you do for me?" And he had some tooth decay, he had some teeth missing. We did all kinds of things for him. And the end result turned out really nice. I mean, it changed him to a different person. So with him, he was missing some teeth. We put some implants in for him. We changed the shape and alignment of his teeth, make it look nice and harmonious again. And that was his smile. It changed his whole personality.
So if you don't like your smile, and we're out of time, but somebody watching this,
Yeah.
and there's two groups, like as you mentioned.
Yeah.
Really bad teeth, they don't want dentures.
Yeah.
Then you've got the denture wearers. So let's say they're watching this, they're hearing what you're saying, but they're still afraid, or they're going, I don't know, maybe I'm too old, whatever. What do you say to them?
I just invite them in, know their options. Get them to listen to what we have to say, get them to understand what the options are, and then make a decision based on the facts.
Okay. Now we need to mention that in Canada, just like the U.S., dental implants are not covered by insurance.
But we have financing available. We can finance things. People make payments. People buy a car with payments. People buy a kitchen renovation with payments. Why not with your teeth?
So you don't carry yourself. You have lenders that you're going through.
That's correct.
To
Yeah.
So if they have decent credit, you could get them financed.
Yeah.
Okay.
Yeah.
You do it all the time.
All the time.
So people are actually asking to finance it.
All the time. Yeah, happens all the time, and we're happy to set it up for them. It's easy.
Good. So you see every patient when they come in.
Yes, I do.
Okay. And you've got lots of videos on your website. Can they even schedule an appointment by just going on the website?
Yeah, they can. Lots of videos, testimonials, explanations of things we do on the website. And the best thing is that you come in and come and see us, and so we can talk about it.
I want to thank you for coming to the show. Great stuff.
Thanks for having me.
Good. You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.